I nominated NAMI because I myself was a NAMI president in 1990 to 93, and because I saw how hard we worked, all of us, at that time until now. And I was also excited to see that the same people that replaced me are still very much involved. So for me, the exciting thing is to see this rather small Howard County NAMI chapter grow to a very powerful organization.
As a volunteer for NAMI, I do a number of things. One of the things that I am most proud of is 5 years ago, I went to a workshop that Susan Hessel, the director, presented for parents of children and adolescents that had mental health problems. And there was no support group for parents. So another parent and I got trained by NAMI National, and 5 years ago this September we started our first monthly support group. And it's for parents of children that have been diagnosed with mental illness from kindergarten age up through 18, 19 years of age. And what we basically do one night a month on a Wednesday is we have a support group. We get the parents, they vent, they cry. We give information, we let them know that they're not alone, that there is hope. We laugh a lot, we talk about struggles, and we celebrate successes because our children can have successes.
I am a co-facilitator for the Connections support group. We're all peers. We all have a mental illness, and that's the beauty of it because the people feel that they can open up and really talk about important things. I have mentored for the peer-to-peer class, which is an excellent class because it provides information about how to prevent relapses. It deals a lot with mindfulness. It's a great course. It changed my life.
Well, first I need to say that I came to NAMI 6 years ago not knowing a thing about the organization. And what struck me about it is that it is a grassroots organization. The organization runs because of the volunteers. All of our programs that we offer are facilitated by volunteers, and without them, NAMI wouldn't exist. So I'm just awestruck by the 45 to 50 volunteers that we have.
I volunteer at NAMI because I also need the support. At first I thought NAMI was just for adults, and I found out that it is not just for adults. It is for those of us that are now having our children diagnosed at an earlier age, such as mine at 4th grade. And I needed the support, I needed the information, and I needed to give back. It has not only helped me, but it has also given me information to help my son. And this Friday, my son will graduate from high school, passing his HSAs and with honors. So there is hope for children with mental illness.
I was diagnosed with bipolar disorder in 1997. It came on the heels of some new discoveries about my life that I was very, very excited about. And that excitement triggered a manic episode, and I didn't sleep for 3 days, eat for 3 days. I talked incessantly. I started hearing voices, started feeling things that weren't there. And my husband took me to the hospital, and there I was diagnosed with bipolar disorder. And I've been in and out of the hospital probably since 1997, about 5 times until 2003, when I took myself to the hospital. Prior to that, other people took me to the hospital, but I took myself in 2003, and that's when my recovery started in earnest. And as a result of what NAMI did for me, I am now extremely passionate about helping other people discover that it's okay to have a mental illness and to get treatment for it, because you can recover.
All of our volunteers are either people who live with chronic mental illness themselves, or they're people who are family members who love someone who has a serious mental illness. So they have a huge burden to bear in life in coping with all that they go through, but yet they have this extreme need to help other people so that they don't have to go through the same hard times that they did till they found NAMI.
We needed some help. So after searching around, we found NAMI. We got some advice from them as to how to proceed in terms of getting help for our son. And my wife and I took the Family to Family course, which is a 12-week course for family and loved ones of people with mental illness. That course totally changed our lives. My relationship with my son went from one of total frustration and total anger to an understanding. And it was through that course that my son and I came back together and developed a relationship. And realizing how life-changing that was, I decided that this was something I needed to pass on to other people because there is help out there, and I wanted to be a part of passing that along.
I volunteer at NAMI because it not only keeps me involved, but and I have progressed greatly since I've joined NAMI, but it also gives me a chance to give back, and the interaction with people in the groups helps everyone. It helps me too, you know? So that's why.
I think it's a wonderful award. I think it's long overdue for NAMI. We have a core of many volunteers, and we go throughout the county volunteering wherever we're needed, whenever an organization calls, whenever a parent or a consumer calls that needs help. So I think they could not have picked a better volunteer organization than NAMI.
I also want to profusely thank ACS because it's a fantastic organization. My background was education. All I knew was teachers and principals and those sorts of folks. And it is so wonderful to live in Howard County and get to know all the humanitarians that are working so hard in Howard County to help people. So I'm very proud to have NAMI be represented here and to be honored by the Association of Community Services.